You see that ST elevation. You're calling a cardiac alert. You should put defibrillation pads on them just to be safe. Or should you? Let's talk about it on this One for the Road. You've probably heard the advice that if you see ST elevation and you're transporting a cardiac alert or you're transporting directly to a cath lab, that you should put defibrillator pads on the patient just in case they go into arrest. Now, I'm all for preparedness, but I think we need to give this very common advice some further consideration. Spoiler alert, I am not going to tell you to put defibrillator pads on the patient or to not put them on the patient. I think it's appropriate in some cases and it's not appropriate in others, but I do think we need to think about the implications and we need to do it right. So first, let me explain what we're talking about here. So it's called precautionary defibrillator pad placement. And the idea that we advocate for is if somebody has signs and symptoms of a heart attack, possibly ST elevation, that we want to put defibrillator pads on the patient's chest so that if they transition into VFib in front of us, we can shock them immediately, right? So it's ready for a quick shock. And I want to tell you that I've had that patient before. I've had more than one patient who had ST elevation, who I was transporting as a cardiac alert, and they transitioned into ventricular fibrillation. So I do understand what we're talking about, and the advice is not unsound. But I think we also need to address what adrenaline does for a patient who's having a myocardial infarction, right? I think we all agree that adrenaline isn't helpful to that patient. Keep in mind that just about anyone sitting on our cot has seen a defibrillation in a movie or on TV. They understand what those pads are for, and they understand what those pads can do to them, right? So just like we sometimes give the advice that maybe we shouldn't transport patients who are having myocardial infarction emergently because the adrenaline that we create may be counterproductive to what we're trying to do, we also need to keep that in mind when we're talking about putting defibrillation pads on them. So I'll take both sides of this, and I'll say first, if you're not going to put pads on the patient when they have ST elevation, when they meet cardiac alert criteria, if that's not going to be your routine, you do need to have pads nearby. They should be ready to deploy at a moment's notice because that patient is at high risk for VFib and sudden cardiac arrest. If you do it, if that is part of your routine, I feel like it should not necessarily be routine for all of our chest pain patients. I do feel like we can sort of make a decision about the criticality of the patient, take a guess about the likelihood of transitioning into cardiac arrest, and maybe not just deploying it as a matter of course, but doing it more thoughtfully. And if you do it, it needs an explanation. We need to say something to the patient about what it is that we're doing. Mr. Smith, I'm going to apply some large pads to your chest. It's not a necessity, but I want to make sure that you're safe and that we're ready for anything. Some type of dialogue with the patient that lets them know that you're not considering shocking them, but that you do feel like it's the safest thing for them. Look, we're all trying to do what's best for the patient. And this is one of those issues that great providers can firmly disagree on. I understand that. The important thing is that we understand the implications of our actions. And in this case, placing defibrillation pads on a heart attack patient, while it might seem benign, might not be. I hope you'll take that into consideration. I would love to hear your thoughts on this. Leave a comment down below and tell me what you think. What side of the coin do you fall on and why? I appreciate you watching. I'm Steve Whitehead, and that was One for the Road.